Are you feeling like you've got a sensation of something stuck in your throat, like a pit or like a stone, or like trouble swallowing, like there's like a ball of phlegm in the throat? And maybe you've had all kinds of tests done by your doctors, specialists, and they couldn't really find anything. Today, I want to talk about resolving a throat blockage, dysphagia globus, using acupuncture. So my name is Cynthia. I'm your Balance Method acupuncturist, and I'm going to go into the details about what are the issues going on with a throat blockage and how acupuncture can resolve it without having a needle in your throat. So yeah, I'm making this video because I have had a few of these cases recently, and I'm just really happy to talk about how common this is and how it's fairly simple to treat with acupuncture. This is a very common situation that an acupuncturist is seeing in clinic. And so people that are going through this sensation, some of them have gone to the doctor and they've had to have all kinds of endoscopes and ear, nose, and throat doctors and poking around and pushing things down the throat, and it's quite unpleasant from what I hear. I feel for you if you've had to go through that. And after all that testing, they may not have found anything according to Western medicine. So this is where it's interesting. If we look at what Eastern medicine has to say, we're looking at energetic blockages that are happening in the channels that run through the throat or that affect organ systems whose channels are also going through the throat. So the first one I'm going to talk about is the conception vessel. I'm going to show you a picture here. This is the conception vessel channel, and it's running right along the midline. You can see it's going right up the center front of the throat. And when this channel goes out of balance, there can be a feeling of blockage of the throat. It's like a knotted up energy. With this, there can also be lung problems. You know, when we think of the throat as the upper respiratory pathway, and with lung problems, we're going to see asthma, bronchitis. We can also see here issues affecting the ear, nose, and throat. When this conception vessel is weak, we're going to see, or affected, we're going to see a radial pulse. So that's, I'll just show you on my wrist here. The radial pulse is running right above the radial bone. A radial pulse that is going to be deep. So when I press on it, I have to really press down to feel the pulse. And we might also see the mood is affected. There can be fear, melancholy. We can also see someone who is really wants to nurture people, maybe over nurturing, wanting to nurture plants, animals, and there can also be trouble looking after one's own needs. Okay, so if we only need one or two signs. So I'm going to show you here the point that opens the conception vessel. It's located on the wrist. It's right here, lung 7, which is on the radial side of the wrist. So this is what I'm going to work on. So I'm just going to do a needle in here. Okay, so this is the point opening up the conception vessel. running down the midline, running through the throat. Another channel that runs through the throat area that can be affected is the Chung vessel. And I'll show you here, this image is a picture of the Chung, and it's running through the throat. And the symptomatic picture here is we can have people that have acid reflux, right, where the acid is coming up the esophagus into the throat. So any kind of GERD issue. We can also have stomach problems because this channel crosses with the stomach channels. So there may be a picture of nausea, bloating, stomach pain, tightness. The Chung Mai is also linked to the chest. So anything in the chest, such as tightness in the chest, breathlessness, asthma, constricted breathing, anxiety, a sense of heat rushing up to the head or the face. And also, interestingly, a lot of female problems are part of the Chung Mai picture. So this can be issues with the breasts, such as tenderness of the breasts premenstrually. This can also be issues with the menstrual cycle, and this can also be postpartum problems. Okay, so the Chung Mai is opened by a point on the foot called spleen 4. So I'm just going to show you this point. So it's found on the medial side of the foot and at the base of the first metatarsal bone, so that's right here. Now this point can be a little bit tender on people, so we just go at an angle here. And there we go. So this point is opening up the Chung vessel running through the throat. So that's our second strategy for addressing a throat blockage. And another approach that I've used quite a lot recently is where there is a block between two channels. So this is what's called an exit-entry block. So this gets a little sophisticated, but you have 12 main acupuncture channels. I'll show you a picture here. And the energy flows through these 12 channels every 14.5 minutes. So it starts with the lung channel, and then in order, there's little arrows here, it goes in a sequence until it gets to the end, which is the liver channel. Okay, now after it leaves the liver channel, it loops back to the beginning, which is the lung channel, starts again. So when people have a blockage at the end of the liver channel, which is liver 14, then what can happen here is the blockage in the liver starts to make it very hard for the energy to move into the lung, the next point on the sequence, which is the lung channel at lung 1. And so what this looks like is a person's liver pulse, which is right on the radial wrist here. This is the liver pulse. This will be quite a stagnated, full pulse. It will feel like very firm, very thick, very like large and strong. Okay, excess pulse. And then correspondingly, The lung pulse, which is on the other side, it's near the wrist crease here. This will be a very weak pulse. I might not even feel anything here, or if I feel it at all, it will be just very hard to feel. It will be very soft feeling or very faint. And that's because the energy is not getting to the lungs. And when the energy is not getting to the lungs properly, then we're going to see all kinds of breathing problems, asthma, shortness of breath, sometimes a feeling of suffocation. Some people get this at night, tight chest, tight throat, and because this is the whole upper respiratory pathways. So there I have shown you my main strategies for treating a throat blockage so that you don't have to have a needle in your throat. Isn't that great? And hopefully not have to have any more of those endoscopes, because those are not comfortable. Often what I'll do is I'll use all three of these strategies together if indicated, just to ensure the best results for my patients. Also, if there's a feeling of constriction in the throat caused by an imbalance in the liver system, there can also be a feeling of tension, or sometimes a feeling of depression or oppression because of a very congested, imbalanced liver. And I'm just going to have some of my peppermint tea here. This is also very good for the liver. Helps to get the liver energy moving. So there you have my three main clinical strategies. If you or someone you know have been through all these tests to figure out why there is this blockage, and you're left still wondering what the cause is and what you can do about it, you now have some insights from Eastern medicine and acupuncture. If you're in Toronto, you can come and see me. And I look forward to helping you work through this problem. Okay, so thank you for joining me, and I look forward to connecting with you in the next video.